So the Situational Judgement Subtest on the UCAT is one that is all about ethics, so today I'll be doing a full Situational Judgement Subtest live on camera. Hey everyone, and welcome back to the YouTube channel. If you don't know me, my name is Emil and I'm a first year medical student studying at Monash University in Melbourne, Australia. And on this channel, we help high school students trying to get into undergraduate medicine in Australia. So if you're new here, consider subscribing. Since this is a no BS channel and I always value your time, I'll show you my UCAT results from 2020 up on the screen now, and I'll get straight into the subtest, but all I ask in return is that you drop a like on this video and consider subscribing to the channel. Okay, so we're at the start of the Situational Judgement Subtest. Let's just get straight into it. Okay, so two medical students, Chris and Justine, are about to complete a joint patient interview. Both students are required to take part. Chris informs Justine that he does not feel able to take part. Taken some illegal drugs this morning, to which he may be addicted. Okay. Justine, when deciding how to respond. The joint patient interview is completed as planned, so to not adversely affect the assessment. So I think this one would be D, because Chris has taken illegal drugs this morning, and if they were to just take it as planned, that could affect the patient. Establishing whether Chris needs help. Yeah, this one would be very important. That the consultant is made aware immediately that Chris... Yeah, this would also be very important because taking illegal drugs is a significant issue. That Chris does not interact with patients if he is not in a fit state to do so. I think this is also very important. New scenario, we've got Paul and Laura work together in a clinic. The clinic informs Paul that Laura told her that in her first year of medical school, she submitted an assignment that she'd copied from a friend. She's normally very honest and trustworthy. The receptionist is known to have told lies about students as well, previously. Okay. The alleged incident occurred a long time ago. This one would be not important at all, in my opinion, because regardless of how long ago it occurred, plagiarism is considered a serious offense. Whether there is evidence that Laura copied the assignment from a friend, yes, this would be very important because the receptionist is known to have told lies, so he'd probably need more evidence before actually going and doing anything. Laura's feelings if she did copy her friend's assignment and this is uncovered. This is not important at all because it's, again, a serious enough offense. The receptionist's past history of telling lies about students and medical staff. So I think this wouldn't be... I think this one would be important to consider, but not very important because you still would need to chase up this issue because plagiarism is that serious of an offense. Okay. A student, Stephanie, becomes concerned about the professional behavior of Antonio. She has noticed that Antonio is often rude and can be rough, and it is clear that the patients are uncomfortable with his behavior. So how Antonio's behavior may affect the patient's perceptions of the health profession. So I think this one is important, but I'm not quite sure whether it's very important or just important. Because the reason I think it might be B is because the perception of the health profession doesn't necessarily matter as how much Antonio's behavior is actually affecting the patient's care. So that's why I think it's B. Patients may withhold important information if they do not feel comfortable. This would be very important, yes, I think, because that's when the patient's care becomes compromised. That Antonio's behavior may affect patient willingness to help with future teaching activities. This again, because I think it's not as important about the teaching activities as it is about the care. So this one, I think it will be B. Antonio's potential negative reaction doesn't matter at all because it's a serious issue. Okay. Sarah is a very good junior doctor and a consultant often praises her. She's on a ward round and two other junior doctors. The consultant attends to each of the patients. asks the junior doctors for the results of the blood test, and Sarah realizes that she had told the other doctors that she would do it, but has forgotten, and the patient is listening. So Sarah has to decide whether or not she should admit the mistake. So being honest with the consultant about forgetting to order the blood test, yes, this is very important. This is probably the main thing in the scenario. That admitting to this mistake may affect her reputation. This doesn't matter at all. That if she does not admit the mistake, her fellow junior doctors may take some of the blame. So this one is important. I'm just deciding between A and B. The reason I think it is important is because teamwork is important, and it's not fair for her to put the blame on her other junior doctors if she just does not admit the mistake. However, this shouldn't be like the main reason that she should admit the mistake for, so I think that's why it's B. The need to reflect on why she... yeah, I think this would be A, very important. Okay. Kiara, a medical student, notices a message from another medical student, Mark. Kiara does not know Mark well, and Mark has posted information about a digital examination that he conducted on a patient that day. Referring to the patient as Mr. X, he has posted a photograph of the notes he made. Kiara can see that the name of the patient is visible in the photograph. Okay. That Mark's message is likely to be seen by the other students, and therefore it was likely that someone else will report. So this is not important at all, because you don't want to assume that, and you just want to report it yourself. That other students may benefit from Mark's note about the examination. So this is not important, but I'm trying to decide between C and D. I think it's D because there's a breach of patient confidentiality, and that is important enough that it wouldn't matter whether other students are benefiting or not. Tina is a dental student who shares a house. One of the housemates, Emma, has become withdrawn and rude, and Emma was initially very friendly. Change in behaviour has begun to concern her housemates. And she has missed a lot of lectures and failed an assessment. So that Emma seems to be going through a difficult time and someone may need someone to talk to. So yes, this is very important. The situation may improve anyway without intervention. I think this is definitely not important at all because it's affecting the other people in the house. So she should definitely check up on that. That Emma may not wish to discuss the matter. Yeah, I think this is also not important at all because it's affecting other people. Medical student is due to attend an appointment with her supervisor. The opportunity to attend a clinical session becomes available, and the student knows this would be of value to her learning and development. So the importance of a meeting with her supervisor, yes, that is very important because that's like the main issue in the first place. That other clinical sessions may arise in the future that will be of value. So this would actually be, yes, very important, I think. Because if there are more clinical sessions that might come up, it doesn't matter if she misses this one. Her supervisor's view on whether this clinical session would be a valuable learning opportunity. So this one I'm thinking, yeah, it's definitely important, but I'm not sure how important it is. So I'm thinking A or B. But I think specifically because they say that the student knows this session would be of value to her learning and development, it doesn't actually matter as much what her supervisor thinks. So this one would be B, I think. A student is on placement in the emergency department. They have been approached in the ward reception area by an upset patient. A consultant has been talking loudly in the reception area, and the patient says she's concerned because this means that the consultant might have spoken loudly about herself. Akeno thanks her for bringing this to attention and apologizes as well. The patient wants to know what will be done about it. So I think I will let a supervisor on the ward know. This would be very appropriate because he's telling her exactly what he's going to do about it. I think it would be more appropriate if you spoke to the consultant rather than myself. This one I'm actually really not sure, because I think it would be inappropriate, because you wouldn't want the patient to have to confront the person that she's sort of worried about. But then also it would make sense for the patient to bring it up to the consultant, because that's the person who has caused the issue in the first place. So I'm immediately thinking it's not A or D. I think it's B or C. I don't think that it will cause harm, so that's why I'm going to pick B. I will ensure that the consultant is made aware of his behaviour and that a complaint has been made. So I think this is definitely appropriate, but I'm trying to decide between A or B. I don't think it would be A, because the patient wants to know what will be done about it, and in this sort of quote, nothing necessarily is being done about the issue that's had. So I think it's B. Sean is a medical student working on a shift, has been asked by the senior nurse to take a blood sample. It is necessary to take the blood sample as soon as possible. Sean is comfortable taking blood. Tells Sean that she's concerned he's not capable of doing it, and no one else is available. I've completed this procedure many times, there's nothing to worry about. So I think this one would be B, because yes, he's valid in saying that he can do it, but he shouldn't say that there's nothing to worry about. Would you prefer if I found someone else to take your blood sample? I think this one would be B as well, because it would sort of alleviate her concerns, but there also isn't anyone else around. Actually, I think it might be C for that reason. This one I'm not too sure about, I'm gonna flag it. This would be A, because it asks the patient to tell them what's wrong. There will be a delay. This one would be B, I think, because it's basically the truth. Susan and Manuel are attending a lecture, having a family emergency, and suspects that the test message is related. The lecturer asks Manuel to leave the room. Okay, ask the lecturer to allow Manuel to stay, explaining that his text and messages were necessary. So it'll be inappropriate because it causes like a ruckus. Say nothing, as it is not appropriate. Susan Tiffany, I think this is appropriate because you don't want to just cause issues in the lecture hall for no reason. Tell Manuel, I think this would also be appropriate because he should speak up for himself. Dentist undertaking a routine checkup on a 10-year-old boy. The boy starts crying and screams that he wants to go home. Ask the boy's mother to try and calm him down before proceeding. So I think this is B because you shouldn't necessarily proceed with the checkup straight away. Stop the checkup and ask the boy some questions. So this would be very appropriate because it allows the boy to calm down and you spend the time you need. A student is running late for his meeting, had to reschedule twice. He sees an unaccompanied elderly patient in the corridor who appears to be lost. Highlight the patient to a passing nurse, then continue the appointment. This one is appropriate because it tries to solve the issue, but I think it's B because he should do it himself and you don't know whether the nurse will be able to do it. Ask the patient if he knows where he needs to go and then ask an available porter to accompany them. Okay, this would be A, I think, because it solves the issue directly. Direct the patient towards the hospital information desk. I'm thinking that this one would be C because the hospital information desk might not be able to do anything about it. But I'm not too sure about this one actually. Highlight the hospital signage to the patient. This one also, I don't think it really helps the patient that much at all because they probably can see it, so I think it's C. Maya is one of a group of medical students. Pathologist is showing students around. Nick starts making jokes about one of the dead bodies. she finds him offensive and disrespectful. Ask Nick quietly not to make such jokes. This would be appropriate because it's not causing disruption because it's quiet and it tries to solve the issue. Do nothing about Nick's jokes. This would be C, I think, because you want to stop things that are offensive and disrespectful, but also it might be difficult to intervene in this group of medical students. Tell Nick in front of the rest of the group to stop making such comments. I think this would be C because it does something to solve the issue. I actually think this one might be D, to do nothing about it. Tell Nick in front of the rest of the group to stop making such comments. Yes, this will be inappropriate, but not awful because you're trying to solve the issue, I think. Student enters a lift. Several members of public are standing with him. Registrar enters the lift with a colleague and they're discussing a patient. So taking the registrars aside and informing them that they're likely to be overheard. This would be very appropriate because it tells them exactly what they've done wrong. Observe the registrar in other situations to see if she talks about other patients in public. So I think this is definitely inappropriate because there's no need to do that. If they do it in the lift, you should just try to fix the issue straight away. But it also does make sense to sort of see if it's a repeating offence. So I think it's C. Whilst in the lift, yes, I think this would be very appropriate. Doctor is working in a team that is looking after this person. One of the nurses is not contributing, often late and not fully prepared. Ask the nurse if there's a reason. Yes, this would be very appropriate. Allows the person to explain themselves. Tell the nurse that the issue will have to be raised formally. I think this would be inappropriate just because you don't necessarily know what the issue might be. So I think it's C. That one I'm not too sure about though. Ask the nurse whether he would like any support. This would be very appropriate because it addresses the issues the nurse might be having. Dr. Fenton is attending to a boy. Mother says that she's worried about her son being treated in this hospital. High rate of infection. Hospital has a bad reputation. Asks if it's true. Dr. Fenton has not seen the newspaper article. Okay. Reassure the patients that the hospital considers. Yeah, I think this would be very appropriate because it sort of assuages the patient's concerns within reason. Offer to find more about hospital infection rates and discuss with the patients. So yes, this would also be a very appropriate thing to do, I think. Tell the patient that Ben performed the check incorrectly. Oh, this is a new one. 2 medical students are in an outpatient clinic and examining a patient's abdomen. Performs the examination incorrectly and does not find any abnormalities. Since they're both students, so telling the patient that Ben performed the check incorrectly. I think this would definitely be inappropriate because he's also a student, so he doesn't necessarily know that he's correct for 100% sure. And also doesn't need to necessarily apologize for it. So I think this would be C or D. I think it'll be C. It's a bit hard though. Ask a specialist registrar to identify whether or not, yeah, this would be very appropriate because they're disagreeing. This would also be very appropriate because it sort of fixes the issue. A junior doctor is working on his first day. One of the nurses belittling him, not competent, and the nursing staff will have to deal with the outcomes. Okay. Discuss the incident with the supervisor later that day. Yes, this is appropriate, but he should probably go to the nurse first. Discuss with the nurse later that day. Yes, this would be very appropriate. Except that junior doctors, this is definitely not appropriate. Greg, a dental student, is taking part in a clinical placement. They are all friends. Amy makes an inappropriate joke in front of Marek. He does not say anything but appears to be upset. Wait until Amy is not there. Yeah, this would be very appropriate because it doesn't like start a confrontation. Immediately challenge Amy politely about the inappropriate joke. I think this would be appropriate but not ideal because, you know, it might embarrass Marek as well. This one I'm not too sure about as well. Immediately report Amy's behavior. Yeah, this would be definitely inappropriate. I think very inappropriate because it's completely unnecessary. Andrew has been working shifts for the past 4 weekends. He doesn't have any plans, looking forward to having a weekend away from work. Heidi is scheduled to work, would like to have time off. Will work the following weekend instead of him. Andrew is aware that doctors are able to shift, okay. Suggest to Heidi that she tell her consultant that she cannot work at the weekend due to family condition. Yeah, so I think this would be very appropriate because then the consultant can probably work something out between them. Suggest to Heidi that she ask another colleague to swap with her. That would also be very appropriate because people are allowed to swap. Anders is on a clinical placement. He has had the opportunity to take blood. However, he is still lacking confidence and it's the day before his exam. So he can ask a junior doctor to supervise him while he practices on patients. Yes, this would be very appropriate. Obtain some, this one would be D, definitely. Review his lecture notes about blood taking techniques. So this would be, I think this would be appropriate but not ideal because he has the opportunity to practice and he should, because otherwise he just like will never practice. Okay. A student is currently completing a group assignment. Samuel complains to Patricia saying he has done a lot more work and he suggests that the remaining work should be redistributed to account for this. So she can suggest to Samuel, they should have said sooner, should acknowledge it. So I don't think she should do it herself because it's a group project. She can, I think this would be the most appropriate and this would be the least because this just doesn't do anything about the scenario, suggesting to Samuel that he should have said sooner. But then this one does sort of address the issue. Toby has a weekly group tutorial session that takes place between 9 and 10. Jeremy arrives 10 minutes late. Jeremy takes his children to the nursery, always waits and finishes on time. Okay, so ask Jeremy to send his children earlier. Okay, so I think this would be the least appropriate just because it sort of just throws Jeremy under the bus and like doesn't help him to solve the issue at all. I think this one would be the best because then everyone can sort of get a better time and get a better learning experience. Theresa is observing a junior doctor. Ross is attending to a patient with a broken finger, blah, blah, blah. Trusting on his arm that looks dirty and thinks it needs change. Theresa has never changed her wound dressing. Okay. So I think raising the concern with the nurse on the ward would be the most appropriate, and then this would be the worst because Theresa doesn't have any experience, so she can't just do it as a medical student. Sky and Graham. Sky has become concerned that Graham is depressed. He has taken several days off sick from his placement, and then they used to meet up in the breaks during their placement. Okay. So asking Graham if he would like to speak would be the most appropriate for sure. And then monitoring Graham's behavior probably does like nothing and just doesn't help the scenario at all. So I have 3 minutes left, but I feel pretty confident on most of the answers I've done so far. So I might just skip to the end and I'll show you the results for what I got. Okay, so as you can see, out of the 69 questions, I've only gotten 6 incorrect, which I'm actually really happy with. So I'll go through the answers now and show you guys the explained answer for each of the questions so you can see maybe where I went wrong. So that was me doing a whole situational judgment subtest live on camera. If you found it helpful, do check out this video of me doing an abstract reasoning subtest live on camera as well.